Welcome back to NTV Weekend Edition, and now we're joined by Dr. Ahmed, who's a consultant pathologist. And Dr. let's just get straight into it. 27 of 34 samples have been found to have the Omicron variant. Is this enough to formally say that Omicron is the dominant strain in Kenya right now?
Yes, I think so, because 34 samples is quite a good number. Remember, these are samples that have been tested out of positive samples. So basically, patients who are tested positive, their samples are collected, and then those samples randomly tested. Out of them, 34 were taken, and 27 out of 34 means almost 80% of them are already Omicron. Just a few weeks ago, we knew it was the Delta variant, which was more than 90%. So having 80% now being Omicron means Omicron has taken root, because only last week, the ministry was saying there was no Omicron in the country. Within a week, we are now having it at 80%. And I think that's a good enough number.
And in your view, how long do you think that Omicron has been here? Because you're saying, the government was saying about a week ago it was not there. In your view?
As we said last week, and actually earlier this week on NTV, I think Omicron has been here for a while. My guess is that it has been here for at least 3 to 4 weeks. Remember, in South Africa, when they announced to us mid of November, they were already having it in community circulation, which means they probably had it a few weeks earlier than that. So I guess that the first few cases that came into the country came at the end of November, and by now we're actually having community spread, and the ministry has actually admitted as much, because if you see most of the samples that were positive of the Omicron, they are actually within the local community, people who had no history of travel or any connection to people who had traveled earlier. All
right, and we're seeing that the infection rate altogether is going up. And today, for the last 24-hour period, we're at 23%. In your view, do you think that we should start expecting more stringent measures, containment measures, as we are seeing with Rwanda, Uganda, and the likes?
I don't think so, because I think we can borrow a leaf from what's happening in South Africa. They have had a very huge surge, a very massive spike in the numbers. But what you have noticed in South Africa, they did not go into lockdown or social restrictive measures. They did not have to close bars and others. But in the process, they managed to contain this, because although the numbers are going up, but hospitalization rate has been low, the number of deaths have been low, which means the reason why you actually go into those measures is to try and make sure that the health system doesn't get overwhelmed. And right now in this country, I think we only have 9 cases in ICU. We still have a good capacity. I don't think we even need to go there yet. And I don't foresee us getting to that point, because what's happening in South Africa and the similar picture in Kenya, a lot of people already have immunity, either because of previous infection or because of vaccination, which means even if there's Omicron, we don't expect to get very severe disease as so in the past wave.
All right, and there has been there's a bug that's going around. People have got the flu. A number of them, many people are having hoba. And you find that some will go and get tested for COVID, and they actually find that they're actually COVID positive. So should we all who feel that we have a homa go and be tested? Because there's that kind of anxiety. There's a balance between disregarding it for a normal flu and still and not overreacting to it.
Yeah, I think the most important thing is to emphasize that right now we are in this flu season, and what we call common cold, common flu, which is circulating around. And remember, COVID is also one of these respiratory viral infections, so it will also circulate around this time. But the key thing is anybody who has any flu-like symptoms, they should stay home. They shouldn't go to work. They shouldn't they should actually isolate. And their contacts similarly should not go to work, should not get out and spread, because you don't want to also spread even homa, because homa can also make somebody sick. But we also know that for the ones who have COVID, some of them could be COVID, and the only way you can be able to know that it is COVID or not COVID is if you go and test. So if you're able to go test, go and have yourself tested. If you are positive, then you isolate. But even if you are tested negative, you still need to isolate, because anybody with flu-like symptoms, the best remedy is to stay at home, take care of yourself, and don't pass it around to other people. And it is for real that what is going on right now, most of it is actually COVID. And Cambridge just said we don't have much influenza going on. So what is going on right now is the common flu or COVID. Unless you get tested, you will not be able to know.
All right, Dr. what you said there could be a very good micro clip that people will share with their bosses to get off days, because
100%. If a good boss is the one who will tell their workers, stay home if you have fever, if you have headache, if you have body pains, stay at home, because you don't want that person coming to work. And we know Omicron is highly infectious. That person coming to work will infect other people. So you might as well have them working remotely than coming to the office. That is what I'll prescribe to everybody, even in schools, even in fact, like in the mosques and the churches. If somebody is having fever, don't allow them in. If somebody is having a headache, don't allow them in. This is the time for people to stay away if they are feeling unwell.
All right, and we are a week from Christmas. We are in the festive season. So then how do we have this balance? Because you're advising that, we don't need to get into the most stringent measures such as, lockdowns, etc., curfew. But we're in the season where in our African culture, we're already planning how we are all going to go into one place as a family. We trust each other, which has been one of the pitfalls from the professional fraternity. So then, how then do we have that balance, one? And also, what does this mean for our healthcare system? Are we risking having a new year with a burdened healthcare system?
So I think it's also in our culture not to harm people. So if you actually have any symptoms or signs of an infection, stay away from your relatives, stay away from your friends and your workmates. This is a time for people to have that personal responsibility. Actually, in the UK, for example, they have not even gone to lockdown, but a lot of the social places are actually seeing reduced numbers because people are actually staying away because of personal responsibility. What I'll say is that don't travel, don't invite people if you actually have symptoms, because that is when these things spread. And right now, we can actually be very worried to infect others, particularly people who have not been vaccinated, people who are elderly, because they are still at risk. Remember, it is still COVID, it can still kill. We shouldn't assume that just because there are fewer cases of severe illnesses, that it is mild. So what we are trying to avoid is a situation whereby this actually surges and then it forces the government to take draconian measures, because this is the time to actually keep it low. We can mitigate it and stop it from going to that level whereby the health system gets overwhelmed. Our health system is actually much better than it was ever before. We have more ICU beds, more oxygen capacity, but that doesn't mean that people should fall sick and take a risk or even risk their relatives and their loved ones. Yeah.
And so do you then feel that the government should become a bit more firm in regards to pushing people to get vaccinated, so that we've seen there's been concerns about which the courts have put a pause on. You don't get vaccinated by the 21st of December, you will not get government services. Do you feel the government should then ramp up these efforts to just kind of box people into vaccinations?
Personally, I'm not an advocate for mandatory vaccination or vaccine mandate, because medical ethics dictate that people should be given autonomy and they should be allowed to make their decisions. I think what is important is for government and political leaders, religious leaders, all leaders in general, celebrities, the media, to pass the right message, to have these persuasive discussions with people and convince them, because I think it has been shown clearly, even here in Kenya, that when people are educated about something, they'll tend to accept it more. The more you try to force it down people's throat, the more they'll get suspicious. And I think this is the platform to remind people that these vaccines are absolutely safe. We have not had a single case of severe reaction or death in the country because of this vaccine. And that's the only way you can be able to beat all this conspiracy theory. And for the people who are able to get booster vaccination, and also for celebrities, for religious leaders, by actually telling people that this is safe and going around telling people we have been vaccinated, you can pass the right message. It's disappointing that when you go to political events, nobody's talking about COVID, nobody's talking about vaccination. But I don't think forcing people to be vaccinated is even legal in the first place. Definitely is unethical, and I don't think this is the right way to go. What is the right way to go is to actually convince people, pass the right message to them, and more people will get vaccinated. Yeah.
All right. In closing, Dr. For the avoidance of doubt or assumption, are we saying that Omicron is not as lethal as Delta?
No, for the avoidance of doubt, what we are saying is that the picture we are seeing in South Africa, which has the first Omicron wave, is that they are not seeing as many deaths or as many hospitalization as in the previous waves. And we think that could be because a lot of people already have immunity because of vaccination. They have a higher rate of vaccination, and also because of past infection. But what is without a doubt is that Omicron is still killing people. In South Africa, in Europe, it is still killing people. So people should not take it for granted and should not disregard it, because it is something that can be deadly. I would like to advise people that as much as possible, make sure you wear your masks, try to avoid close crowded spaces, get vaccinated. If you are in a closed environment, make sure it's ventilated, but masks are very, very important because you don't know whether you'll be among those people who, if you get infected by this Omicron, it will end up being severe and kill you. And you don't also want it to happen to your relatives or your loved ones. So we should not disregard it just because on a public health perspective, it is a lower number than what we are seeing in the past. We still have Omicron and it's for real.
Thank you very much, Dr. Ahmed Kalebi, who's a consultant pathologist, for giving us your insight.